So melanoma often presents as an irregular dark brown spot on the skin. This can occur from an existing mole that is changing in color or shape, or it can present as a brand new spot that develops on the skin where there never was a mole. It doesn't matter what your age is, what color your skin is, what your race is. It can affect anyone, anywhere, in any site. Another common myth is that melanoma can only happen on sun-exposed areas, and that's absolutely not true. Melanoma can develop on the bottom of the foot, under a fingernail, in the scalp. So melanoma can develop anywhere on the body at any time.
Dermatologists always recommend to get an annual skin check, meaning that you go in and see a dermatologist. We look at your moles from head to toe at least once a year. Skin cancer is one of the most common cancers in the United States, so it's very important that everyone gets it done at least once a year. Early detection of melanoma, which is the deadliest form of skin cancer, will significantly reduce both morbidity and mortality.
Risk factors for melanoma include a family history of melanoma, the amount of sun exposure, particularly sunburns in early childhood, play a big role. Tanning bed exposure is also a big risk factor for melanoma, and as well as the number of moles a patient has. The more moles you have, the higher your risk of melanoma. It's also important to examine your own skin and look for any moles that are new or changing. Some of the key features to look for are what we call the A, B, C, D, E rules. And A stands for asymmetry. One side of the mole doesn't look like the other side. B stands for irregular borders, so the borders are either jagged or indistinct and smudgy. C stands for color, so there's different colors within the mole. And D is diameter. Any mole that's larger than a pencil eraser can be concerning. And E stands for evolving, and that means a mole that is changing in size, changing in shape, changing in color, or also moles that are itching or bleeding. So I recommend skin checks across the board to Caucasians, Asians, African Americans, it doesn't matter. Melanoma can affect anyone.